So when I was just entering medical school, I went to a lecture that was given by a retired Army surgeon. And he was giving a talk about battlefield injuries and unfortunately the deaths that occur. And he said that, the soldiers don't always die necessarily because of their wounds. They often die because there's not a surgeon available. So he said, there's this newfangled thing we've been working on, and it's a way for surgeons to be at a distance. They stick their hands in this little machine. Has gloves on it. It has tactile feedback, and they put their their eyes in this little screen. And right now it's attached by a long cable, and this thing's about the size of a boxcar. But an assistant can be on the other side and helping. But there's a robot that he is now controlling that's performing these surgeries. And I was fascinated. And he said, well, right now it's a big long cable, but they're working on this new wireless thing that probably won't be out for another 10, 15 years to the public. This was 1997. 4 years later, I was in medical school, UC Davis, and I was doing research with a urologist who was one of the first urologists to begin doing prostate surgeries with the Da Vinci surgical robot. And now 90-something% of them are, I think, really done that way. But anyway, I was actually headed for urology, and then I discovered orthopedics and changed my mind and went to orthopedics. So I thought, I'll never get to use a robot. Well, as it turns out, spine surgery has advanced. I am now certified to perform robotic spine surgeries with the assistance of a robot. But I also became certified in being able to perform robotic joint replacement surgeries. If I can do it with a robot, why not do it? So I just actually finished doing a robotic knee replacement on a very lovely 70-year-old woman who had a horrible knee arthritis. And the nice thing about using this technology is incredibly accurate. You know exactly where things are going to go. And we have this surgical robot called the Mako robot here at Watsonville. There are no other hospitals in Santa Cruz County or Monterey County that have this technology. I think the closest is up in the Bay Area somewhere. But it's a nice thing to be able to offer the community, to be able to perform these hip and knee replacements with a robot, which somebody would expect to be at an academic center or in places where I don't think people would think that this is something that we'd be able to do at Watsonville, but we do it. It's fantastic, and technology merging with good healthcare delivery makes me quite happy about getting up and coming to work every day.